Okay, so it sounds quite complicated. When a patient comes to you for cataract surgery, which tests will be done? What can they expect, and what will you see from that to determine what procedure will work best for them?
Okay. Yeah, so when so because we want to identify other diseases and we want a perfectly normal, healthy eye, apart from the cataract, when we want to perform what we call a custom lens replacement with these multifocal or extended focus lenses, that's going to give a degree of spectral independence. We need to make sure that we look at all the various structures. And when I see my patients and we go through all the tests, I normally start either from the back or the front. So if we start from the back, we, for instance, do an OCT scan of the nerve. So an OCT scan is where we use light, like a CT scan, where a CT scan uses X-ray waves and MRI uses sonar or radio waves. OCT uses light, and we go and we look at all the various structures at the back of the eye. And we look at the nerve, we see whether there's any signs of glaucoma. We look at the macula, which is like the CCD or the film of the eye, and we see whether there's signs of macular degeneration or whether there's a little scar tissue growing, we call it an epiretinal membrane. Then we move a little bit into the front, we look at the lens, we try and quantify the opacity. There's various instruments like the eye trace or the HD analyzer, we call it. This is just fancy words, but we look at what we try and quantify the degree of the opacity. And then we move to the front and we now specifically look at the cornea and we want to see whether there's astigmatism. So astigmatism is where the cornea, the front window of the eye is shaped like a rugby ball, because that can also be addressed at the time of cataract surgery. We also want to see is there enough cells that's going to keep the cornea clear. Because when we perform cataract surgery, we actually reduce some of these cells that's responsible for keeping the cornea clear. And we just want to make sure, uh, is the cells healthy? Are there enough cells? And then, of course, we end up with a general test where we look at vision, we look at pressure, and we also look at your tear film, which is very important because tear film is temporarily affected with any type of surgery, eye surgery, whether it's cataract surgery, laser surgery, glaucoma surgery. It does affect the tear film temporarily, and the patient can struggle with a bit of dry eyes for up to 3 months after the procedure.